So we're back to part two of this video, and we just have reviewed the impact of, of social isolation. And now we want to know, what the heck do we do now? Because Mr. Isolated has just told you that he is considered killing himself as he just gets hurt, or he just hurts too bad. You know that he has a gun based on the comments he has made. So what are the warning signs of suicide? You can look back at the warning signs of suicide and review those. You also want to, and why don't we just take a moment to do that? We will look at the warning signs of suicide, and let's make it so you can see the whole slide here. And the warning signs of suicide are some of these behaviors: talking about wanting to die, talking about being a burden to others, feeling hopeless, trapped. Remember, the trapped is part of the mnemonic, is path warm. Feeling very sad, anxious, agitated, sometimes full of rage. Just having unbearable emotional or physical pain. Changing behaviors such as making a plan or researching ways in which to die, withdrawing from friends, taking risks, mood swings, eating or sleeping more or less often, and using drugs or alcohol more often. These are the warning signs. And we're going to review, is path warm? This is a mnemonic that I really think is an excellent mnemonic. And this is going to help us know as far as the risk for suicide. And if someone has ideation, suicidal ideation is what they call it. That's where they're talking about ways to die and wanting to die and talking about death. That is a big warning sign. Substance abuse, of course, increased or excessive use of substances, feeling that they have no purpose in life. P is for purposelessness. A is anxiety, and again, we looked at these warning signs, sometimes an agitation and anxiety. T, trapped, feeling trapped. There's no way out. H for hopelessness, hopelessness about the future. W is they're withdrawing from friends, family, maybe sleeping a lot. A is anger, uncontrolled anger, rage. Seeking revenge would also fall under the A for anger. Recklessness and mood, dramatic mood changes. So is path warm? And that's a great mnemonic to be able to really remember this, make a little card of it, especially if you're dealing in mental health. So a couple of questions that I want to ask. Questions 1 to 3. When individuals are kept from using a specific suicide method, they simply find another way. Is that a true statement or a false statement? That means if they're kept from perhaps using their gun, they're just going to find another way to commit suicide. True or false? Actually, it's a false statement. So if individuals are helped to stay away from the suicide method that they may be talking about, especially a gun, that does not mean that they're simply going to find another way to kill themselves, to commit suicide. That there is a significant decrease in the likelihood of one committing suicide if their means of suicide has been removed from them, their access to that means. The same with medication. If they're talking about committing suicide by overdosing, if that medication that they would have overdosed on is taken away, that doesn't mean that they're going to simply find another way. That you can significantly decrease the risk of somebody committing suicide by doing so. Now, nothing is 100%. Individuals are up to 5 times more likely to die from suicide when there is a firearm in their home. True or false? That is a true statement. So it's very important to have firearm safety, even if the person who uses that firearm is not suicidal. Someone else in the home may be, and then they are more likely to die from suicide when there is an accessible, especially, firearm in their home. Firearms are more deadly than other methods of suicide. That is true. I think we can understand why that's true. There's little room for error if a firearm is being used in a suicide attempt. So we can check for your answers on this site. But the last thing before we end our evolving case study is a human service directory. So I'm going to open up this link. It is PA211. And let's make sure you can see it all here. And you will be able to click on this link as provided to you. And when you click on it, one of the best ways is to search for services. Now, this link originally was developed by the social work department at Gannon University and now has been taken over as far as by the United Way, so they can update it. So you can see there's many different counties that are included, not just our Erie County here, but other counties that this information is informative for our local area. Searching for services, if you look through, you can see some of the services that information is provided on. So for Mr. Isolated, are you concerned about food, getting food for him? Well, no, not right this instant. Maybe that is an issue in the future. Are you concerned about mental health? Yes, for sure. Is that the most important service? Perhaps for him it would be. Crisis intervention is another service that you would want to look at. So crisis hotlines may be potentially something to look at in mental health. So I will let you look at some of the sites here under mental health. We know that crisis services is also going to be essential for Mr. Isolated right now. So I will let you look through this information as you complete your evolving case study. So just to finish up then your discussion board, when you click on, here are the 4 questions that I introduced you at the very start of both videos, and you are to answer all 4 of these questions. The first 3, what are your concerns? What are the risk factors or predictors of social isolation that you see in Mr. Isolated? What are the negative health outcomes of social isolation? And after someone has told you that they considered killing themselves, such as Mr. Isolated, what do you do? And now, again, if you're in primary care, you are absolutely going to get the provider, the physician, whoever is seeing that patient today, the nurse practitioner, you will absolutely be collaborating with them. This is not all you. This is a team effort, but you do need to be aware of what services now are going to be available for Mr. Isolated. No replies are required this week, so this evolving case study is what I wanted you to work through and to document in your discussion board. And there's just a couple of optional reads, worth the quick read that they are. Women who live with gun owners are more likely to take their own life using a gun, and the increase in homicides and suicides continue to grow. So that's it for this week. And while this is heavy information, it is nursing information. And it is nursing information for us, especially dealing with those with chronic illness, chronic pain. And it is important that we know of resources and even mnemonics. How do we engage? How do we talk with someone that is suicidal?